ready. Are you going?
Yeah.
Okay, hello, I'm Rachel Gallagher. I'm here to do my OSAT technical exam. You will hear from Edward about this, but there was a small mix-up where my kit did not contain a suture or a skin pad. So this I'd already opened on my first attempt, but wasn't able to complete. Either way, you should hear from Edward about this. So I've already opened the packet, and I will start from here. So I'm just reading the scenario. Okay. I will open my kit and assemble my materials. This is my little sterile area. Make sure I have everything good to go. I would also introduce myself to the patient and say, hello, I'm Rachel. I'm a medical student. I will be repairing your wound. I'd also grab a suture, and for this I would pick the monofilament option, the nylon, because it is strong and not braided, so would not get easily infected. I'd also get my sharps container, my local anesthetic, and my cleansing solutions. So at this point, I would wash my hands and put on my clean but not sterile gloves. I would irrigate the wound with saline, probably about 500 milliliters, to make sure that there's no dirt or anything gross in there. When I am not sterile, after I irrigate the wound, I would do my local anesthetic. So I would probably use the 1% lidocaine, because that's fast onset of action, and a 25 gauge needle. I'm not gonna actually drop the lidocaine because it says we're not supposed to, but you would put the needle on, fill the syringe with whatever amount of air that is equivalent to the liquid that you're gonna drop, exchange the air for the liquid, and then inject the local anesthetic just right under the skin along the wound. At this point, I would change it to my sterile gloves. I don't actually have sterile gloves, but I can pretend. And then I would take my iodine prep solution and prep the area, starting towards the wound and moving around outside as I go. And I would also, ideally have done this first, but I would drape the area with my drapes. And I only have 3. Ideally there'd be a 4th one there to complete that draping area. At this point, I will start to suture. I'll open up my suture packet that is sterile. Load it into my needle driver. Use my pickups. And when I go in, I want it to be perpendicular to the skin. I'll do this in 2 bites. Oops, got caught there. So at this point, I would put my needle down, and do my instrument tie. Oh. struggling a little bit with this, getting it to stay tight. I'm just gonna try this again. Make sure I have a good enough tail. I'll just do my second tie there. Sorry, it's a little bit loose. Okay, actually, I'm gonna start this one over. I'll just start again there. Sorry about that. With this, I'm going to make sure that I'm going in about the same depth that I'm going out on the other side. My paper towels aren't cooperating with me very well here. Let's try this again. Sorry, my dog is really trying to get my attention right now, so I'm a little flustered. Oh. And she ran away with my paper towels, but I'm gonna try to keep going. Crossing over, doing at least 4 knots to make sure this nylon suture stays. Oh. Just gonna do a couple more. Okay. And I will grab my scissors, snip off the edges there. And then I'll do my second one, which is a 2-handed tie. I apologize about the lack of sterile field. I'm not going to pull through all the way on this one so that I can do my 2-handed tie. And since I'm not going to be using this needle anymore, since we're just doing 2, I'm going to cut the needle off. I'll get ready to do my 2-handed tie. And again, I'll do at least 4 total knots. Just gonna keep going. This is my last one. Okay. Those look pretty good. Snip the edges there. And at that point, those are my 2 sutures. So I will tell the patient after I dress it to make sure to keep the area clean and dry. And since this is on his foot, come back to get these removed in probably about 10 days. Thank you. Sorry for the dog interruption.